Hip structures, are they preventing your child's milestones? Yeah, they can be, pretty much. First of all, we are really made the same for a reason. The structure of our bodies are here not to be linear, right? If you really want to get into the linear structure of standing, you can look at our presentations with Dr. Kim Huggins and myself that we did at Harvard years ago. All right, we have to get away from linear-based standing. Therapy stand is not 5 inches apart, feet parallel to one another, right? They protect the Queen of England and they're at the Swiss Army at the Vatican. I can't even tell you the amount of psychological testing that these people go through to guard such treasures of the world. It is just such an abnormal stand, and we use it constantly in therapy, starting with the stander. I'm not saying that the child doesn't need to be upright. I'm not saying the child doesn't, that's what we were meant to do. It is a requirement, not a goal. But when the hips present in such a way, we cannot treat children in standing as if they're protecting, the King of England. So when you're looking at the structure of the hips themselves, and this is where, again, I think my fascination for architecture comes into play. If you're looking at the overall hip, right, it's supposed to be formed eventually into a 125-degree angle, right? But it's not done straight. We don't have straight legs in here, right? We actually have a little bit of a torque. And it's the formation, what I look at is the top of the arch, the arch. So you have a keystone, which is your sacrum, right, going into the columns, right, your legs. But it's really important that just like in an arch, that these rocks are placed in a certain position, right? That load is in a certain angle position to load us. And from that, now we're also in a neutral. When we get into a vertical, our neutral is that we can work around all of this, right? And so anybody who thinks, and this is where I disagree even with Feldenkrais with the 5 lines, that the legs, are just, like we're not Jack in the Box. The legs in particular are going into those kind of things in that momentum, because now the pelvis now works independently. And on top of that, the coccyx needs to have this nice pendulum swing going around. Pendulum different than going straight and fro. That'll start to begin with as a child's learning fecal matter and the load through the coccyx and so forth. And then we learn to control that. And then sometimes it gets stuck, and that's constipation, or it's an open valve and we don't have toileting control, right? But that coccyx also, if I'm tilting, that coccyx knows how to load. This is why we put stuff on our mouth. The gravitational responses are the jaw and the coccyx, right? The mouth and the anus. And so when I'm tilting and I go to, so when a child's going, ooh, 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 pick me, that coccyx is in there, not only giving balance, but it guides momentum, right? So when a child, first of all, let's say that the femur heads have gone straight, which is coccyvalga, the hips might be in, folks, but let me tell you, when you have a coccyvalga, that coccyx mechanism can't work. And when it goes to work, it'll go asymmetrical. And this is what bounces it off and what you look at dystonia. And again, because the hips are going, right? The femur heads, I should say. And that's where doctors no, the hips are fine. Well, then note on the report, the coccyvalga and the incomplete ischiums. That's another thing that you'll see lots of times with munchkins, rare genetics or CP. Now they say the ischiums, the sit bones, close in by age 7, right? But if you have a child that's sitting on these little pokey things, especially when your child wants to sit towards you, then away from you, suspect that the ischiums are incomplete. Because again, that bouncing mechanism, and then off of that is your pubic bone, and it goes through there, and then once it gets this vertical, that's why independent sitting is so important, because first of all, it connects the midline, but then it also starts to cross the midline, right? And now you're starting to load through the pubic bone, the coccyx and all that, and the trochanters in the femurs, right? When I go to reach for something, right? What I'm actually doing is my trochanters, my hips, are reaching in and going across. So I stabilize and I can go reach for something. When you have CP and the trochanters lock, you'll see this with the wrist or the wrist. They can't go in and out. They can't transition. The same with your trochanters. That's the little knobs in the side of your legs. Those are your trochanters. Now, I have something what's called femoral torsion, where my femur head is supposed to look like this all the way around, and instead mine's torqued back. So from straight on, it looks like I have coccyvalga, but if you look, you'll see the torque of my femur heads, right? So I get very crooked legs. I was born with club feet, and instead of evaluating my hips, they put the Dennison bars on my feet, torqued out my feet, and then they torqued my hips out. Eventually, when I replaced my hip, they better put in a crooked hip because I'm a crooked lady. And there's videos of that also on YouTube. When the hips are not forming, right? There's a couple of things that you have to look at it happening. First of all, you have to look at where the load is. And by the way, another one is coxivara. You can look in this. It's not an anatomy class. This is a movement class. Understanding how the structure of the hips affect the movement. Now, you have another problem is that instead of loading now the pelvis, it starts to load the spine. You don't want that to happen. That's when you're going to load an early scoliosis. Another problem with scoliosis that you have if your child is not getting up into standing is usually when the sexes come in. That's also when the scoliosis really goes to town, because your sexes are meant to, again, fall between your legs. And they don't, they fall to the floor, and that really starts to skew up the back. That's why you start to see increases of scoliosis during that time. Again, the way the pelvis is structured, we structure our sexes, we structure our organs, we structure everything off of the standing. It's not just the hips. But to ask someone to do anything, a device, you remember, you can't have a device to make a movement. Right? You can't have a device to prevent a movement, right? You can't, it's an exterior meant for internal processing. No devices should be used without a thorough hip examination, including an x-ray, so you know where the child's at. Because again, if the child's already presenting, let's say, with hip dysplasia, and now you're going into risk of scoliosis, maybe for that child, that particular standard or whatever is not what you need to use. But if you also think that a child's going to stand and walk versus transition in and out of standing, that's going to be a problem. Also, my conversations of the hips as the child ages and those femurs get longer, right? Especially if there's coccyvalga, coxivara, that's where you're going to see possibly a regression, or the hips start to pull out a subluxation. A lot of people think that that's spasticity, but a lot of it's just load variations because of the length of the femur. So those are just some of the reasons why, key reasons why your child's hips are everything. They're everything. And another thing too, for movement wise, the hips, the pelvis is the only area where the movement goes in all directions. This is the importance of Moro. Moro is thought to be a startle reflex. It's not. It's the first time that your body is articulating gravity from all 5 appendages, including your head, your arms, and your legs, sort of like, again, that jack-in-the-box thing, through the pelvis. Then the pelvis picks up movements, how to transfer movement through the pelvis, which it did not have in the womb. And that's the presentation for that. So anybody who's saying you've got an overactive startle reflex is because your child does not know how to lie down and have an absolute horizon. It has nothing to do with a Moro. But they say otherwise. I disagree. But those are the reasons why the pelvis is so important. It will be a foundation to who we are. And if, too, you're taught anatomy, that eventually the coccyx will disappear. If that happens, then the computers have won, and none of us will be walking. So it's a very important aspect of the human body. Again, women are presenting different than men for the size for the having babies through, but other than that, we are all kind of made the same. When you look at an x-ray, it doesn't matter who we are, we're the same. But we're that way for a reason, it's for the structure of movement. The skeletal system is a structure for movement. You have to stop looking at the skeletal system as a structure for support, right? Movement needs to be structured. Thanks.